my name is Sarah McCullough Cleary, and I'm a registered nurse, and I'm here today to explain the benefits of breastfeeding. How do we know how to properly nourish our precious new bundles of joy? Do we choose to feed our sweet new, very dependent baby based on what our parents or friends tell us? I'm here to educate you not only on the benefits of breastfeeding, but how it can be a difficult journey. There are numerous benefits to both mother, child, and the economy. The American Academy of Pediatrics, the American Medical Association, American Dietetic Association, and the World Health Organization all recommend breastfeeding as the best form of nourishment for babies. They believe breast milk is the most nutritional choice, and although breastfeeding may not be possible for all women, many women make the decision to breastfeed or formula feed on their comfort level, education on breastfeeding and formula, lifestyle, and specific medical considerations they might have. Not to mention the amount of money that can be saved when you do not have to buy formula, or you only have to buy small amounts if you choose to breastfeed and supplement. There's many benefits for baby. Breast milk provides baby with antibodies from the mother to help prevent illness. And according to the World Health Organization, research shows that breastfeeding reduces childhood mortality rates. And according to womenshealth.gov, breastfed babies have lower risks of asthma, childhood leukemia, type 2 diabetes, ear infections, eczema. They also have a decreased risk of respiratory infections and decreased risk of SIDS. There's many benefits for the mothers too. Per womenshealth.gov, breastfeeding helps the mother's body heal post-delivery. This is because during nursing, the uterus continues to contract, and that helps with the involution back into the pelvis. It also decreases the risks of postpartum hemorrhage due to the contractions. It minimizes bleeding. In addition, breastfeeding also helps lower the risk of type 2 diabetes, certain breast cancers, and ovarian cancer. Breastfeeding also makes it easier to lose weight postpartum. You're burning extra calories when you are making and nursing the baby, making milk and nursing the baby. Women who breastfeed exclusively for 3 months tend to lose more weight than those who do not, and those who continue to breastfeed beyond 4 to 6 months continue to lose weight as well. With breastfeeding, there is definitely a convenience factor. The milk is readily available, and you're able to satisfy your infant's hunger immediately. There's no mixing up bottles or warming up bottles in the middle of the night for night feedings as well. The average cost of formula feeding is approximately $1,500 for the first year. There are some costs that come along with nursing babies. That includes, if you choose to pump and store milk, you've got sterilization bags, storage bags, and nursing pads. These are all things that have minimal cost, and for the nursing pads, you can also get the reusable ones, so you can just wash them instead of the disposable ones. And some people choose to store their breast milk in bottles, and that can be frozen as well versus using the disposable bags. For those that choose to breastfeed, there are some key factors to success, determination being one of them. Breastfeeding is something to be learned. There's a learning curve for both the mother and the baby. Many common complaints from breastfeeding mothers is nipple pain, and another is fear of not producing enough milk to sustain the baby. When mothers are nursing, they tend to feel like that they don't feed the baby enough milk or produce enough milk because nursing babies tend to feed more often. This is because breast milk is very digestible. An infant has an immature digestive tract, and it is still growing, and formula is much more difficult for the baby to digest, and that's why they go longer in between feedings. So that's an important factor to know for a nursing mother, that they are producing enough milk and that they are sustaining baby. If they have healthy weight gain and are reaching milestones, then they're doing everything correct. Another important key factor is seeking help from either a lactation consultant, your healthcare provider such as a pediatrician, or your OBGYN or primary health care provider. They have great resources, and generally they are very knowledgeable on breastfeeding. These providers can also help provide education to the parents, not only the parents, but their spouse or partner or support system. Because as I said before, determination is a key factor to ensure success. I hope that this has been informative and helps you make a wise decision in the nourishment of your baby. Thank you.